My name is Sister Monica Okon, Monica Okon.
Okay.
Okay.
Just put that on instead of.
And the religious order, please.
Handmaids of the Holy Child Jesus, HHCJ.
That's it. I remember that one from last year. Sister Monica, it's crazy to think that it's been almost a year that our health systems have been dealing with the pandemic. Can you describe or sum up what this last year has been like for you personally?
Yeah, this year has been a year like no other. But before I go into that, I want to recognize and honor all religious sisters nationally, and especially in New York, and in particular at St. Francis Hospital of Catholic Health. And I really want to emphasize the importance of having the leadership of Sister Pauline, who is the director of Pastoral Care Department. Her encouragement has been our encouragement, and my encouragement in particular, to be able to be there for people who were vulnerable during this challenging time for about 1 year now.
I'm sorry, go ahead.
Go ahead.
I was just going to ask, so, I mean, how would you describe what the last year has been like?
The last year has been a year of meeting with death, meeting with fear, meeting with families, staff, and patients who needed support like never before. When I talk about challenges, that includes short staff, not only in my department, doctors, nurses, all the caregivers. And it was very, very challenging because some got sick and had to, when you are sick, you cannot take care of another sick person. And some got scared and they were not able to come back. And so we had to be able to work with a certain number of staff, and the work was not getting easier as these challenges were coming up, were increasing. For example, I met one of my nurse managers ran to me. Sister Monica, please, do you have a minute? I'm like, I have more than a minute. What is it? Please, would you come and see how you can listen to my staff? Whatever support, whatever encouragement, whatever prayers, please, we would like you to come with your energy, your positive energy to our staff. And so it's what we do, but every minute, every day, every unit, every room you enter is unique. You don't know what you are going to meet. You don't know whom you are going to see. Even though we have the list of patients with their names, going into the room, you are there to find out if this patient, this is actually how he prefers to be called. So you have to do that. But let me come back to during this pandemic, supporting the staff was not lesser than supporting the patients and their families. So you could see on their faces the fear. Do I have the virus? Or am I doing enough? Am I doing my best? So I had to be there for them, to encourage them. Yes, you are doing enough. Yes, you are doing your best. Yes, you have the right to be afraid. And I will take my time to tell the staff, take your time and gown up. I see the compassion in their heart. I see the love. I see the caring. But you have to also take care of yourself to be able to take care of others. So in as much as I encourage them to do their best, I also encourage them to take care of themselves, because that is very, very important. And then going into patient's room was challenging at the initial time. I had told myself I was not going to be able to go into the room. That is because I myself, I was scared and trying to be like, what I am telling others, I should also be able to do that myself. But how can you stay away from a patient who is dying and there is no family member around? I remember going into a room. No family member is in this New York, all in California. And the daughter called. Please, all I need you to do is go in, gown up as much as you can, protect yourself, hold her hand, whisper into her ears, tell her, I am thinking about you. I would love to be by your side at this time, but I am not. Tell me how you will be able to say no to that. The family is crying. The patient is dying. The staff, helpless, but doing their very best. That is the summary of what it was like to work during the pandemic. And I want to really, really appreciate the staff, my own colleagues, my fellow chaplains. I want to really be grateful to the nurses, the doctors, the pharmacists, even the environmental staff, everybody that stepped into this hospital, into a room, into this facility, is a blessing, because everybody is vulnerable to the worst scenario, but brave, coming together, not because anybody is forced to. You see them still having the energy, even with the fear. And I do tell them, I said, you have the right to be afraid. You have the right to be mad. None of us know this, what is going on. So it's a blessing to have the kind of staff that we have here. And we could never ask for more. So it's a big blessing, and I pray that God continues to bless them, to strengthen them physically, spiritually, psychologically, financially, and in any way they may be in need. God will provide for for thinking about others. Because when you talk about religious sisters, what is it? This is my own personal understanding or meaning or definition, call it whatever you want. For me, or if I did, at the beginning you asked for the religious community that I belong, the Congregation of the Handmaids of the Holy Child Jesus. I grew up in Nigeria and was missioned in the USA. So it has been a very, very rewarding and satisfying experience for me to serve here at St. Francis with the blessing from my community and the support that I get from my community as well as all those I have met. So, and the acceptance of this community, I could not emphasize it any longer because, or more. It's amazing of how people in this community make use of their relationship with whatever is important to them. There is a big religious commitment here, but also people know what they want. People are able to make use of the services we have. And I will really also, I don't know who is going to see this video. I don't wish you to get sick. I don't wish you be in the hospital. But if you ever find yourself in a hospital as a patient or as a family, please request for pastoral care services. Spiritual care is very, very important for you. You may be able to make use of what we have.
I thought that was lovely when you emphasized that, you know, a lot of people think that pastoral care is just for people who go to church, but it's, you know, you're here for everyone who is here.
Yeah.
So I thought that was a great point to emphasize.
Mm-hmm. It is a special call. It is a gift to respond to, not only for myself, but to love, to serve in action with other religious sisters, with other people that you are working with, for others. To serve people who need help. People who are in fear, people who do not have hope. Your presence, your mere presence, a smile, is to be able to mourn with those who are sorrowful and to laugh with people who are joyful. Is to be able to listen in the moment, be in the moment with patients, with families, with staff, and of course, with myself. So, it's a blessing to serve here and to see where people need help and to be able to support in any way possible.
You know how awesome you were. That was perfect. That was wonderful. And thank you for sharing that. One of the questions I have.
One next question, if I may interrupt, just if you can try to avoid the microphone. I know you're doing a lot of hands.
Okay.
If you could do all that, that's great.
Okay.
Try not to touch them.
Okay.
It's
So,
okay. It's okay.
But it's good. I love all this.
okay. Not this, not here.
Yeah.
The story about the nurse manager who wanted you to speak to the staff. You know, they want Sister Monica to come and comfort them, and they expect Sister Monica to be up here at a level 10 that can't be easy every single day for a full year. How did everyone in pastoral care, how did you, I guess, what was your motivation to try to be at a 10 every single day and try to make yourself available and offer what people needed? How did you, or what motivated you?
What motivated me was the presence of my sisters in community. And remember, at this time, I'm commuting, at the beginning of it, I'm commuting from Queens to St. Francis. And this incredible woman here was able to, at some point, I can remember Easter Sunday, after that, she's like, you cannot be doing this. You have to come and spend the time with us in the convent. So I stayed with the Franciscan Missionaries of Mary, and they were able to listen to me, and they were able to accept me, and they were able to encourage me. I'm getting to that question. Without her help, I will not be able to help others. Without the help of my sister, Sister Mildred, when I go back, she's at, how did it go today? So what really motivated me is these are people who are vulnerable and they need help. They ask questions and they don't get answers because nobody has the answers. So all I could do is, yes, I am here for you. Please, at your comfort level, speak what you feel I should hear. Say what you feel I should listen to. I'm not going to perform any miracle to say this is going to go away. All I could do is give a smile, say a prayer, sing a song, and guess what? Sometimes I dance. And whatever was helpful, I did that because they needed the energy to move on, to know that this is here. There's nothing we can do about it for now. What gave me motivation? Prayer. I cannot do without prayers, and it comes in form of actually praying words of prayers, and it comes in form of singing most of the time. The song that came to mind most of the time was like, here I am, standing right beside you. Here I am, do not be afraid. Here I am, standing like a lover. I am here, here I am. Words like that. It comes to me, I sing it repeatedly, and I see myself as being there, not even a word sometimes, because you don't know the word to say that will be meaningful. Patients, families, staff, sometimes those silence important to them. Just being there, telling these patients, telling families, telling colleagues, the staff, that they are not alone in this.
I know that was beautiful, by the way, thank you. I know we're by no means out of the woods yet, but what gives you hope moving forward? What makes you optimistic?
God has answered prayers. It gives me hope. Even you look at the census right now, some people may say, oh, we have more than we had at that time. But guess what? To have this vaccine is a big hope. Because at that time, my prayer was, God, bless the doctors, bless the nurses, bless all of us, give us the strength. I always will remember, God, give wisdom to those who are working to find a solution to this. So that has given me a lot of hope for us to be where we are now. It's hopeful. We are not where we want to be, but it's hopeful. And I will also want to use this opportunity to remember those who have died. They may not have been related to me, but they died. And their loved one miss them. They have died and gone. With all the dreams they had. So my heart goes out to those families, to those parents, to those children, to those siblings who have lost their loved one during this 1 year, and maybe still to come. And I want you to know that I am praying for you. We are praying for you. God, at His own time, will comfort you, will bless you, will strengthen you for being there for your loved one, for thinking about them, and for being a part of their life, no matter how short the time was. God will bless you, and please, we are here for you. That's what we do, even in our scariest moments, even in a challenging time. You are not alone. We are with you. God is with you. And I always say, pastoral care is not only for people who go to church. We are here for everybody. We don't care what you believe. Whatever you have connection with, whatever you make meaning for you, whatever helps you to go ahead, to move forward, we are here. Our presence, we are here for you. So may God bless you. May God bless your loved one who have passed. Because over the years, I've come to realize that to be a chaplain or to work in the Pastoral Care Department especially here at St. Francis, part of it is creating a community for people who do not have one. You come in here, you go into a patient, and he or she tells you, all my families are in Europe. I'm the only one here. Or all my family are in Mexico. Or all my family are in Africa. I'm here all by myself. No phone calls. So what do you do in a situation like that? I remember calling another chaplain and invited a nurse, invited a good friend of mine, a pharmacist, and we become a community for that patient. And we told her, if you need anything to support you spiritually or otherwise, that it is possible within our reach, we are here for you. So it's about creating relationship. It's about creating community for those who are in need of this. We are here for everybody. Do not be afraid to speak, to call, to request our presence. As a religious sister, we are here for you. As chaplains, we are here for you. As Catholic Health, we are here for you. God bless you.
I feel like I should give you a standing ovation right now. True. Initially, we were going to do one video with both you and Sister Edith, but I just don't think that. I think you're going to need your own video now, because that was
I think so
outstanding.
too. I don't think that you could just,
That was perfect.
yes.
Is there? I mean, you covered everything that I could have imagined. Is there anything else